Good afternoon. My name is Karen Sampson-Hoffman, and I'd like to welcome you to today's Ask the Expert webcast, Culturally Adapted ADHD Treatment for Children from Spanish-Speaking Families. We are welcoming clinical researcher Dr. Alyson Gerdes. The Ask the Expert webcast series is presented by the National Resource Center on ADHD, which gives the general public access to top clinicians, researchers, and other professionals. The National Resource Center is a partnership between CHAD and the Centers for Disease Control and Prevention, and serves as the national clearinghouse for the latest evidence-based information on ADHD. A recording of today's broadcast will be available through the National Resource Center on ADHD's website, help4adhd.org, underneath Ask the Expert in about 2 business days. To view the recording sooner, please follow the same link you used today. The recording will be available about 30 minutes following our presentation. If you are having any difficulties, please give us a call at 1-800-233-4050, and our health information specialist will be happy to assist you. We are here Monday to Friday, 1 to 5 p.m. at 1-800-233-4050, and online again at www.help4adhd.org. Finally, following today's webcast, a brief survey will appear on your screen. Please take a couple of minutes to let us know what you think and how we can better serve the ADHD community through the Ask the Expert webcast series. It is a privilege to introduce today's guest expert, Dr. Alyson Gerdes. Dr. Gerdes leads research to inform and guide clinicians treating childhood ADHD, including examining evidence-based assessment and treatment of childhood ADHD, culturally appropriate clinical practices, and Latino mental health disparities, and parent-child and peer relationships of children and young people with ADHD. Some of Dr. Gerdes' recent projects include best recruitment practices for Latino families, translating Spanish versions of commonly used assessment and treatment outcome measures, examining Latino parental perceptions about ADHD, the role of culture in parental recognition and motivation to seek help for ADHD, and developing a culturally appropriate measure of functional impairment for ADHD. There's a lot of ADHD involved. For those of you who would like to ask Dr. Gerdes a question about her presentation, we are accepting questions in the questions box on the toolbar as indicated by the red arrow shown in the slide. All questions are moderated, and we will try to get to as many as possible during the question and answer portion of the webcast. Again, we are very pleased to welcome today's guest expert. Dr. Gerdes, if you'd like to begin.
Thanks so much, Karen. I'm not going to spend a whole lot of time on this slide. I do want to try to leave as much time for the Q&A as possible. But just a brief introduction about ADHD. It is one of the most commonly diagnosed mental health disorders in children. What we see with these kiddos are developmentally inappropriate levels of hyperactivity, impulsivity, indoor inattention, and also associated impairments in academic, social, and in family functioning. Unfortunately, we find that these symptoms and functional impairments continue into adulthood. There are 2 effective psychosocial treatments for childhood ADHD, the first being behavioral parent training and the second being behavioral classroom interventions. That brings us, though, to the Latino mental health disparities piece of my work, because even though we have these effective treatments, we don't really have Latino families, especially less acculturated Latino families, are not well represented in the treatment outcome studies that look at behavioral parent training. And so we don't really know how effective these treatments are with Latino youth, especially Latino youth whose parents are less acculturated. Unfortunately, the Latino population is one of the largest and fastest ethnic minority groups, with estimates that by the middle of the century, 40% of the children in the United States will be Latino. I started this by saying, unfortunately, not that the numbers are growing, but it's unfortunate that despite this growth, we don't have effective treatments or know about whether or not we have effective treatments for this population. Unfortunately, we also know that Latino families often do not receive mental health services, and even when they do, they're more likely to prematurely drop out of treatment. So this certainly has led to researchers really calling for more culturally sensitive mental health interventions, particularly for Latino families. So a couple of areas to think about in terms of what would more culturally appropriate treatments look like. My team has focused both on cultural factors that would lend themselves to adaptations to treatment, as well as practical barriers that would need to be addressed to make any existing treatment more culturally congruent for Latino families. So in terms of cultural factors, the work we do is predominantly with Mexican American families, and so when I speak about these cultural values, I'm thinking about that particular subgroup of Latino families. But we do see among many Mexican American families, we see a support and respect for traditional gender roles, where mothers are seen as the nurturers of the family and fathers more as the providers of the family. And we'll see a little bit about how that needs to be taken into account when making adaptations to treatment. And then in terms of family and parenting values, just quickly, the things that we see is that many Latino families place a stronger emphasis on self-control and obedience, and they may be less likely to praise really what we would consider behavior that we would expect from the child. And again, how this plays into treatment we'll address in a few minutes. And finally, this issue related to respect for authority, this really comes into play in treatment with regards to, even if the parents may not quite be buying into what the co-leaders or the co-therapists are saying, they may be less likely to voice the concerns about this, and we'll talk a little bit again about how that could impact the treatment process. And then in terms of practical barriers, the things that we focused on were the fact that there's a lack of bilingual providers, that many of the families with whom we work also lack health insurance and or money to pay for treatment out of pocket. Our families also deal with transportation issues. I think stigma is an issue. Stigma for mental health is an issue, I think, in most subgroups in the U.S., but it particularly is something that we focused on with our Latino families, and also just being unfamiliar with how the mental health system works in the U.S. So the treatment that we developed is Entrenamiento para ser una familia exitosa, or training to be a successful family. And I didn't want to spend a lot of time on development simply because I don't have a lot of time. But a couple of quick things that I wanted to mention is that we did bring a diverse team together that included Latino parents. It included mental health professionals who work with Latino families, and then also ADHD and Latino mental health disparities researchers. And we used a culturally sensitive grassroots approach in the sense that we used current literature that we thought would be relevant to this. We used recommendations from mental health providers working with Latino families. But most importantly, we conducted a series of focus groups with Latino parents. This was 4 separate focus groups focused specifically on parent training, and then the individual sessions of parent training, and really wanted to get as much feedback as we could about what aspects of this would work for families and what aspects our Latino parents didn't really seem to like very much. So that resulted in a number of treatment adaptations. I'm going to talk about general treatment adaptations, session or class-specific adaptations, and then some newly developed classes. So in terms of more global adaptations. One thing that came out of our focus groups is that Latino parents would really benefit from and appreciate more role plays and active parental coaching in the classes themselves. And so that was something that was added to all 8 sessions, where we actually go through role plays, doing it the right way, doing it the wrong way, letting the families role play with each other, and then coaching them along the way so that they really have time to practice the new skills that we're teaching them. Other things that came out that we identified as more global adaptations that happened in all of the sessions. We simplified the handouts in terms of trying to not have many of them, so we tried to really narrow down what are the key points that we want families to be able to remember. And we have little cartoon strips on them now just to increase the visual appeal and make them a little bit more user-friendly. Similarly, families also indicated that video demonstrations that they could take home would be really helpful. So we have each session has various kind of role plays recorded, if you will, that we send home with the family, so that if they forget, how am I supposed to do this, they can not only look at the handout, but that they can also watch the video. In terms of cultural adaptations, we see some of these happening in more of the assessment kind of intake phase, where we have changed the terminology in the focus of the assessment process. We talk about identifying concerns or challenges with parents rather than identifying problems. And we also put a lot more weight on functional impairment. We still look at DSM symptomatology, of course, but we found that asking about functional impairment seems to be more culturally universal, if you will. We also focused on involving the extended family, so trying to get a sense of, are there older siblings, are there grandparents that really are involved in the parenting as well, and if so, trying to get them involved in the treatment process. The other things that you'll see regarding respect for authority, appropriate expectations about change, and then culturally congruent rationale for homework completion, again, we see throughout all 8 sessions. And what we do here is we bring up these concerns based on what our previous families told us in the focus groups and on what the cultural literature suggests in terms of we're going to need to openly address that families may not be on board with us but may not be telling us that out of respect for the co-leaders. That we need to really make sure that we're reminding parents that change takes time, and that if we don't want to lose a family, we need to let them know things may not be getting better yet, but stick with it, and we will keep tweaking things until we do. And then providing really culturally congruent rationales about focusing on encouraging the parents to be more empowered by learning these different skills and in efforts to make the family more successful. And then in terms of practical barriers, we do frame the class as educational rather than as therapy. So we talk about it as class rather than as treatment or sessions. Our goal is to make the whole family more accessible. So rather than identifying a particular child as a problem, we try to focus on how can we make this kiddo and the family be more successful given the challenges that the kiddo may be having. The classes are held in the evening. Of course, they're available in Spanish, which was a huge goal of ours. We also are able to offer the classes free of charge, and we do provide dinner and child care. And this really, again, is really trying to tap the entire family. So we want both parents there, we want grandparents there, so that everyone involved with the child has an opportunity to learn these skills. And then in terms of class-specific adaptations, some of the changes that we made to the daily report card, which is the school intervention that we work with the families to develop is we really increased the parents' involvement with the school throughout this whole process. So typically the parent doesn't get involved in the school meetings about the daily report card until the very end of treatment, when we're basically trying to transition them into taking over the daily report card with the help of the teacher as we start to wean ourselves out. So one thing that we did is the parents are at every school meeting from the very beginning to the very end. They're coming weekly to really be able to increase their comfort level with the school. When we have a situation where the teacher does not speak Spanish, we identify someone in the school from at the very beginning who can come to the meetings with the idea that this person would continue to facilitate any language barriers once we're out of the picture and the family has taken over the daily report card. We focus on a culturally congruent rationale, talking about empowering the parents, improving family communication. We address parental concerns about rewarding expected behavior, and we really try to do this by bringing up we bring up the concerns in hopes that the family then feels comfortable challenging authority. We bring up a few concerns, and we ask parents, what do you think about these concerns? These are things people have said in the past. Are there other concerns that you have? Just to try to create an environment in which they feel comfortable challenging the co-leaders if they're not really on board. In terms of effective instructions, we do talk about the potential role of traditional gender roles interfering here in terms of the follow-through. So what's going to be the consequence if the child doesn't follow the instructions and not wanting the mother to wait until the father gets home to deal with that, but wanting the mother to feel empowered to deal with that when it happens. And then in terms of positive and negative attention, again, we're revisiting parental concerns about giving attention for and rewards for expected behavior, taking over the DRC. We're trying to focus on simplifying that process, making it more collaborative so that the parent doesn't feel like they're in this by themselves. They really feel like they are working together with the teacher. And then final tips for success, really trying to instill hope in the families that change is happening and will continue to happen, and also giving them a few extra new tools during the session. I want to talk just quickly about the more newly developed classes. So one thing that came out of our parental focus groups is time out was not well received by the Latino parents in our groups. So two issues came up with regarding timeout. One is that many parents felt like it was not severe enough of a consequence for repeated noncompliance, which they saw as a sign of disrespect. And the other one was that many parents voiced concern about placing their child in isolation from the rest of the family and felt that that seemed very inconsistent with their values. And so instead, we focused the session on introducing natural consequences for misbehavior and using the removal of privileges and possessions for misbehavior. And we define these things, we discuss them, we role play them, and then this is one of two classes that also is followed up with a home visit. So we go into the home for approximately 30 minutes, and we have them practice implementing natural consequences into the removal of privileges and possessions in the home with their child, and provide coaching for them in the home. And then finally, the token economy, or kind of this home poker chip system that is often used, also is not well received by the parents in our focus groups. And the two concerns that came up here is they felt like the system was too complicated to be able to consistently implement, especially in families where there were multiple children that needed to be cared for. And then the second one was there were concerns that we were trying to enforce too much structure in the home that many of these families perhaps were not used to, or really may not be open too. So instead, we try to dial back this token economy system and instead focus on managing the homework hour and managing checklists. And this involves coming up with a very simple homework hour plan if the family wants to do that, or we have some families who it has worked better for us to help them identify and enroll their child in a community-based program where the homework is done there. This has been particularly helpful in families where language is a huge barrier and where there is a lot of chaos in the home for various reasons. And it seemed like the best path would be to try to get some assistance with this homework in a different setting. And then this class also is followed up with a home visit if we decided to implement the homework plan. And then the checklists, those are focused on morning and bedtime routines. We actually help the families make them in session. They're laminated so the family can put them right up, and we come up with a very simple kind of reward plan where the child can earn something quick in the morning and at bedtime after they've gone through their checklists. And then we also have another home visit here if the family did more of the community-based plan for their homework. Then we will check in with them at home and make sure that the checklists are going well. Okay, I'm going to stop there so I leave plenty of time for questions.
All right, and our questions are coming in, and now is a good time to offer questions to our participants. You can put your questions now into the question box, and we are taking questions. Our first one is coming from Katrina, and she was wondering, you mentioned having teachers, instructors who are bilingual, and she was wondering where she could find solid information in Spanish that she can share with her clients to help them understand what ADHD and what treatment options there are, and better understand the multimodal and how it can be applied in their families.
I would guess that the information that would be available in Spanish probably depends on geographically where this person is. But I can tell you that I have visited Chad's website many times, and I know that there's a lot of information available there in Spanish. I believe the CDC also has information available in Spanish. My team also has translated and validated quite a bit of information too, so depending on what she was looking for, I imagine she could find some things on both Chad and the CDC's website, and then if there's something more specific that she's looking for, it may be something that I could provide or direct her to someone within her geographic region.
All right, thank you. And again, the National Resource Center on ADHD, we have a lot of information. In fact, our entire website translates into Spanish, and our What We Know sheets are also in Spanish. So that's another resource for people who are looking for Spanish language materials. Well, our next question now is coming from Sarah, and she's referring back to when you mentioned that there's a shortage of qualified therapists who work with Spanish-speaking families or who are themselves bilingual. And she was wondering what are some ways that therapists who aren't fluent in Spanish but recognize and embrace cultural differences among the Spanish-speaking populations can work effectively with patients, children, families if a Spanish-speaking therapist is not available.
Well, I guess there's a couple of things I'd want to say in response to that. One is, today my presentation focused specifically on cultural adaptations. The other piece of this really is cultural competence. And so I don't think you can really work well with Spanish-speaking families in terms of providing them the best possible care without having both, working with treatments that have been adapted for them, but also making sure that you are continuing to improve your own cultural competence. And so I do feel like that cultural competence piece really has nothing to do with language per se. It's about making sure that, and it's a process. It's not like I certainly don't feel like I can check off that box. Yes, I'm culturally competent, but my graduate students and I are continuing to go to workshops and read about these things in order to continue to grow in terms of that cultural competence piece. And so that would be one thing I would encourage people, even if they don't speak Spanish, that certainly doesn't impact them in any way in terms of continuing to grow in terms of their own cultural competence by educating themselves and attending workshops and doing readings in these areas. When we first started working with Latino families in this area, I did not have a team of bilingual providers, and so we worked with translators. It's not the best case scenario, but it's better than nothing. And so if we have someone, a therapist who doesn't speak Spanish but is working on their own cultural competence, is working with Latino families, even if they may be Spanish-speaking only, even if they can find someone who could serve as a translator for them so they could still be doing the culturally adapted treatment, but just in English if they had the help of a translator.
Thank you. One of the things you mentioned earlier was the treatment and the standard treatment, the multimodal, and making it appropriate for each family. We have a question from Alan, and he was wondering, how do you address the resistance some parents have to doing a medication trial? We hear often that some families are resistant to it, even though this is part of the multimodal approach. What would you suggest?
So this is my general approach to working with families of children with ADHD, not just Spanish-speaking Latino families, but families in general. We always start, if the child comes in without medication, we always start with a behavioral intervention first. And in fact, there's some pretty good data that suggests that if you start with the behavioral intervention first, and then at some point you have to add medication, that child can be maintained on a lower dose because of that behavioral intervention being in place beforehand. So that's my general approach. We start with the behavioral intervention. We're very upfront with families about that, and I think that they appreciate that, knowing that, hey, we're on board with you. We're going to try the behavioral stuff first. But they also know, typically, I think about our culturally adapted treatment. We assess at week 5 and week 8 in particular, is the child making significant enough gains? And if we have a kiddo who's not, who despite the parents and the teacher's best effort in terms of the behavioral intervention, if we have a kid who's not making enough gains, or we have a kid who potentially even could be, behavior could be deteriorating, then we always do talk to the family about adding medication. And we found that by taking that approach, even families who initially were reluctant are willing to try that with us most times, because we started with the behavioral stuff first. We said, hey, this isn't quite doing what we want it to do. The best option here is to add medication, knowing that the research suggests that your kid could be on a lower dose because we've done the behavioral stuff first. And so I have found that that kind of tiered system to be really effective, not only with Spanish-speaking Latino families, but with families in general.
Well, thank you. One of our previous participants, one of our previous questions, Sarah, she said that she's really interested in the study that you've done and the work you've done, and she would like to incorporate some of your study and some of your research into her practice. And she's wondering, is there a guidebook available? Is there someone she can reach out to kind of incorporate some of what you've just talked about?
We have an article that recently came out in Journal of Latino Psychology that talks about the process of adapting the treatment and then reports on a small pilot of families that we tested the culturally adapted treatment on. So that's available to the public. The treatment manual, the detailed treatment manual is not currently available to the public, but we right now are comparing that culturally adapted treatment manual to Treatment as Usual with funding from the National Institutes of Health. And so once that study is finished, then those things would likely be publicly available as well. But if there's something in particular that she's looking for, she can certainly reach out to me. And if it's something that I'm able to provide her, I certainly would do that.
All right. If she does contact us, we will share that information.
Okay.
Well, our next question now is coming from Luvia, and she was also very interested, and she was wondering, where are the parenting classes that you've talked about taking place, and can parents be trained to train other parents under your program?
So I'm at Marquette University, which is in Milwaukee, Wisconsin, and so that's where the culturally adapted parent groups are happening right now. To my knowledge, there isn't anyone else doing those in the country, to my knowledge. But again, the idea is after we are able to wrap up this study and actually definitively show that the culturally adapted treatment is better than treatment as usual, our goal is to disseminate the culturally adapted treatment so that it would be available to other individuals. I've never seen a mechanism for training parents how to train other parents with regards to treatment for ADHD. Not that that couldn't happen, but it's not something that I've seen in some pieces of a behavioral intervention probably require a bit more extensive behavioral training and background than I would guess most parents would have. So I don't know if that would be possible, but the idea of being able to disseminate the treatment to clinicians, therapists, etc., social workers throughout the country is definitely something that we intend on doing.
Thank you. Well, we've got a question now from Ximena, and she identifies as being Latina, and she was wondering, can you share the emotions you have found in parents that find out that their kids have ADHD? Do you have an example from your practice what that first experience was when a child is first diagnosed?
I'm not sure if Amanda was referring specifically to the Latino families we work with or families more in general, but I think the experience or the reaction is probably similar. I oftentimes, and this certainly is not true for every parent, but I would say in general there's usually a sense of relief from the family to actually know that there's a reason why their child is struggling in the classroom or at home. And I think there's relief in knowing that they're not alone, especially when we do the parenting groups. I think the parents are a huge source of support for one another. I would say that in terms of specifically the Latino parents that we've worked with, again, we're working with usually more recent immigrants, many of whom don't speak English. That's why the treatment was translated into Spanish. And so their experience certainly isn't going to be representative of all Latinos in this country by any means, but those are the families that we work with. Oftentimes ADHD, that term, is not something that the families are familiar with at all. And so part of the treatment is just providing them with some psychoeducation about what ADHD is and what that means for their child and what that means for their family. And then again, my experience has been that knowing that there is an explanation or a reason for why their child is struggling, and knowing that there are other parents who are experiencing similar things usually comes as a relief.
That's something we've heard at the National Research Center on ADHD also, that when there is finally a diagnosis cross-culturally, there is a relief, a sense of, okay, now we know what's going on, now we know what we can do. Well, our next question is coming from Alice, and she was wondering what can she do in her practice to become more culturally competent? How can she be a better therapist for Spanish-speaking families?
I think developing cultural competence in general is probably something that every clinician, therapist, social worker, psychologist, again, I consider it a process. So there definitely are workshops and seminars that are offered across the country. Many of them also are just available online. So that you don't even necessarily have to live in the location or travel to where it's happening, but you can find a number of things online. There also are some really good books about developing cultural competence, and again, to me, that's a very separate thing than focusing on adaptations that you can make to treatment, and I think that all of us can work on continuing to develop cultural competence.
All right, thank you, and I think that's very helpful. Our next question is coming from Alan again, and he's been very interested in all that you've had to say. And he was wondering, in terms of outreach, do you work with Spanish-speaking media or national organizations? How are you getting this information out to the public to help?
That's an excellent question. So we have not used any kind of media as an outlet, but what we do instead is we have spent 10 years or more developing community connections within our immediate community. So this involves priests at church. This involves teachers and school interventionists and principals and school social workers. And we also, in terms of thinking about mental health professionals in the community who are working with a lot of Latino families, pediatricians in the community. And so our outreach has, I guess, been more local, if you will, in terms of making sure that the people in our area, the people who work every day with Latino families in the community, at school, at church, etc., that they're aware of the services that are available for these families. And those really are our referral sources as well. Those are the folks, the priests, the teachers, the principals, etc., who are letting families know about the treatment.
Well, thank you. Well, we have a question again from Sarah, and she was wondering, she's referring back to when you were talking about token economies and timeouts and how these don't seem to be helpful for the group that you've been working with in your study. And she was wondering, have you identified interventions that are not accepted or not appropriate for Latino teens? What you were talking about are often used with young children. What is appropriate and what is not appropriate for teenagers?
So our age group is actually 5 to 13. That's the range that we will see. Our kiddos typically are more in kind of the 6 to 10-year-old age range. I do not work with Latino teens, and so our adaptations have not focused on that population whatsoever. But I can tell you just in general, timeout, you're going to hear some differences about kind of the age range for something like timeout, but we typically, so this isn't specific to Latino families, this is more in general, we typically find that timeout really starts to become age inappropriate at about age 10 or 11. And so it's definitely not something I would use with a teenager, Latino or otherwise. The token economy, or this kind of poker chip system, as we move in even to dealing with our 12 and 13-year-olds, we don't really use chips anymore. We use kind of a point system that's usually kept in kind of a checkbook ledger. So, and again, these are modifications that we make based on age, regardless of the child's ethnicity. But I don't work specifically with teens, but just with regards to the token economy, could it be adapted for teens? Sure. It usually is more of a point system. Timeout I would not see as effective even for our kind of preteens, and so using more of the consistent consequences with regards to natural consequences and removal of privileges and prized possessions, electronics, that kind of thing would likely be more effective with teenagers.
Well, thank you, and I think that's a good idea. There comes a point when a young person does outgrow the timeout concept. Well, our next question is coming from Kevin, and he is referring that you mentioned that extended families are involved in the treatment process, and he was wondering, what does that look like, and if you had some examples. But he also had the concern, especially when we're talking involving parents, grandparents, aunts, uncles, are there some privacy concerns in this approach?
So in terms of what it looks like, we have had several families who the grandparents, at least one set of grandparents, is really actively involved in the child caring. And so those families come to group. So they learn the same skills and strategies that we're teaching the parents, and we are asking them to use those same skills and strategies with the children when they are in their care. In terms of the privacy, it's not something that we have, I guess, ever encountered in terms of it being an issue. I suppose the parents could sign a release of some kind if that was a concern, so they really are giving you permission to have contact with these other family members. But again, it's not something that piece of it is not something I've dealt directly with.
Okay, thank you. Well, our next question is coming from Mary, and she was wondering, how have you tailored your outreach and your treatment when there are varying levels of literacy within the family, or in some instances, the parents may only speak Spanish, but the children are fluent in both English and Spanish? How do you vary the information, the health information?
So when we've worked with our Spanish-speaking only families, what we're really referring to is parents who are predominantly Spanish speakers. I would say not in every case, but in most cases, the children are bilingual, and we even have some cases where the children don't speak Spanish much at all. So all of the materials that we provide, the parents are in Spanish. So any material that both the child and the parent will need to have access to, and that would include things like the school intervention, the daily report card, the checklists at home. All the materials for those things are provided in English and Spanish. So they're right underneath one another. So the Spanish will appear and then the English will appear right underneath it, so that both the parent and child have access to the material in whatever language they feel most comfortable with. In terms of literacy level, that has been an issue with some of our families, especially for families whose education level, the parent's education level may be a little bit younger or lower. We try to keep everything, all of the measures that we use, all of the handouts that we use, we try to keep them at about a fourth grade reading level. And even then we have had situations where we have read the items to parents who still were struggling a little bit with comprehending the reading. I think that got everything.
I think that did. I think that does answer the question. Well, our next question is kind of related. It's coming from Alice again. And she was wondering what resources are available for adults with ADHD and Spanish-speaking families. We know that children who have ADHD very often have parents who have ADHD. So in your program and in what you're working on, what resources do you have available for adults?
So that is very true, especially with fathers. We do oftentimes find that one or both parents will may have ADHD as well. That particular area, again, as a child psychologist, I would refer those families if I thought that they needed their own treatment for ADHD after we had finished the group. But in terms of materials, again, I think that you can find those things on CHAD's webpage and the CDC webpage. It sounds like the National Resource Center on ADHD's webpage. But those are organizations that aren't just focused on kids, and so there would be relevant Spanish materials for adults with ADHD at those locations as well.
Thank you. And yes, the National Resource Center on ADHD, we do have an entire section that has information for adults. And the information is available in both English and Spanish. And also, I'd like to remind our audience that we have a health information specialist who is fluent in Spanish and regularly answers questions in Spanish, and she is available also Monday to Friday, 1 to 5, at our phone number, 1-800-233-4050. And when I say 1 to 5, I do need to remind you that is Eastern Time. Well, our next question is coming from Janet, and she was wondering if there are educational interventions used in classrooms or perhaps part of the more formal IEPs or 504 plans that would be more culturally appropriate for children from Spanish-speaking families. What would you suggest? And you did mention that there was a daily report card that was part of this program. So what are some things that maybe families could suggest or ask for when they're going into an IEP or a 504 process?
So the school intervention or the daily report card is actually one piece of the intervention in terms of what it looks like in the classroom that it remains unchanged. So that piece is not adapted in terms of what the intervention looks like. What the adaptations around the daily report card, though, are the ones that I talked about a little bit earlier with regards to getting the family involved with those teacher meetings from the very beginning and having the parent present at every week at that teacher meeting in helping them develop a reward menu that makes sense for the kid and makes sense for the family with regard to what does this child earn when they bring home that daily report card every day. So there are adaptations in terms of getting the parent more involved, making sure the reward menu is culturally congruent, but the intervention itself is the same intervention that we use with non-Spanish speaking Latino families, and certainly oftentimes is a part of an IEP or a 504 for these kids. So I guess I think what I would say to that is there needs to be some kind of liaison between the teacher and the parent. And I think in most situations that's going to have to be someone else in the school when there's a language difference, which is oftentimes what we find, where the teacher speaks only English and the parents speak only Spanish. And then we will identify someone in the school. I can't speak for the rest of the country, but I know in this part of the country, when we have schools that serve a lot of Latino families, there are always administrative type positions in the school that are held by individuals who are bilingual. And so sometimes it may be bringing in the social worker. Sometimes it could be bringing in the person who answers the phone at the school and works at the desk. It could be bringing in the Spanish teacher, which we have done before. So I think it's really being able to identify someone in the school who can serve as a liaison between the parent and the teacher.
Okay, thank you. And most school districts will have someone available who is Spanish speaking, who can be that liaison and assist families. And many communities, if there isn't someone in the school district, many communities do have resources, and the school should know of a resource where a translator can be made available to assist. Also, another resource would be the local Parent Technical Assistance Center. These are centers set up throughout the country, and if anyone has a question on how to find one, we would be happy to assist them in locating the one closest to them in their state. Again, give us a call here at the National Resource Center. Well, our next question is coming from David, and he was wondering if you know of any programs for Spanish-speaking adults that are similar to what you've described, and he's looking where can he refer parents of his clients, his patients who have ADHD. Are there any such programs for adults that you would know of?
Unfortunately, I don't know of any, not only in this area, but really anywhere in the country, to be honest. I mean, this treatment is an adapted behavioral treatment, so this isn't a treatment that would be applicable to adults. And I don't know of anyone out there who's doing that kind of research in terms of adapting ADHD treatment for Spanish-speaking Latino adults. I'm sorry.
All right. Well, thank you. It may be an area of study or research that perhaps one of our participants would like to pursue someday. Well, we have a question now from Alan, and he was wondering if you could provide any information about Marquette University's peer program for teens with ADHD. Peer or peers?
It's peers. It is an intervention that actually was developed initially for teens on with autism spectrum disorder, and it's focused on friendship building and social skills. And so the goal is to help these kids develop and maintain even one reciprocal friendship. So it's something that is available in kind of different spots throughout the country. I'm pretty sure the one we have at Marquette for ADHD is the only one in this Midwest area, again, because it's most often used with teens with ASD. But it's a 14-week program, and again, it's 11 to 17 is the age range that we see, and the teens are in a group, and the parents are in a group as well. They meet at the same time but in different rooms, and the entire focus is on helping these teens develop and maintain friendships.
Okay, thank you. That sounds like a very helpful and very interesting program. Is there a website that perhaps you could mention in case anyone does have any additional questions on that program?
So there is more information about the program on at Marquette University's in the psychology department website. You'll see a link for the PEERS program for ADHD, and then you also will see a link for the PEERS program for teens with ASD, which is Dr. Amy Van Hecke. That's her line of work. And so both of those can be found on the psychology department's webpage at Marquette University.
Okay, thank you so much. Well, we are coming towards the end of this broadcast, but we have a question still from Tom, and he was wondering, in your research, have you found that Latino families have a specific interest for various aspects of treatment, such as they would prefer behavioral management over medication management, or is that really not so much a question? Is there a preferred approach to treatment that you have seen?
So definitely with the Latino families that we work with, and again, we're working with the subgroup of Latino families, but most of them, the kids do come in unmedicated, so medication is not something that most of them have tried before. I would say in general, they're I don't think resistance is the right word, but in general, there's less enthusiasm for the pharmacological interventions than there is for the behavioral interventions. But when we have had families who have started with the behavioral interventions and we then several weeks into it have recommended, hey, we really think this, your child would benefit from adding some medication to this as well, we have found that in almost all cases the families are receptive to that. But when families come in at the assessment stage, for the most part, these are families who have not pursued pharmacological interventions.
Okay, well, thank you. I think this has been very helpful for our audience. I think this has been a very important webcast, and that your research has been very interesting. Do you have any additional information on your research if someone wanted to go back, look this program up? Where could they find additional information? Is there a contact perhaps they would be able to be in touch with?
So again, on Marquette's webpage, they click on the psychology department. There's a description of all of the research that we've done. There's a list of publications that they should be able to access publicly, and there's also contact information if they had questions or were looking for something that they couldn't find.
All right, well, thank you. This has been, as I said, a great experience, and I think you've shared a lot of very helpful information. For our audience members, we really hope that you have enjoyed this presentation. Please take a moment to send us your feedback through the survey that will appear on your screen at the end of this webcast. And our survey does help us to select and build webcasts that are of interest to the ADHD community, so your time in those couple minutes is a big help, and a big help to the ADHD community. Also, we hope that you would be interested in joining us on Wednesday, June 20th, for a webcast with Dr. Abigail Levini, and she's going to be discussing how to incorporate coaching into your ADHD practice. This is at a special time at 6 p.m. on Wednesday, June 20th, and we hope that you will be able to join us. You can register now at helpforadhd.org or on the CHAD website at chad.org/asktheexpert. This has been a presentation of the National Resource Center on ADHD. Thank you again for participating with us today, and we hope you enjoy the rest of your day. This does conclude our webcast.